Most of this was...
There's a dramatic showdown at Southampton Council's Health Scrutiny Panel.
We're not here to defend... Can I please... Can you do that? Please.
The axing of Bitterne's walk-in service is high on the agenda. These council minutes show city politicians accepted the closure before the public consultation finished. These minutes are dated July 23rd. The consultation closed in September. Following extensive consideration, the Southampton Health Overview and Scrutiny Panel accept, given pressure on the finite resources, the argument advocated by the CCG within the consultation document.
It's not appropriate, I think, to go against what we've already submitted in a public domain. I think that would be highly unprofessional and not appropriate at all for this committee.
The council, unbelievably, have said that they will go on a decision they made before this consultation was published. So they're ignoring the fact that 73% people in this consultation have said that they want this service to remain open, and they've ignored that, and that is simply staggering. And for democratically elected councillors in the city to fail in their duty this evening is deplorable.
Last year, politicians rejected closing the walk-in. At the time, they said that was because they wanted a public consultation before scrapping the service. Now, councillors say they can't take any action. They say all they can do is scrutinise the clinical commissioning group's decision to shut down the facility.
I'm not happy that we will be able to sit here and not change this decision. If it was down to me, if I was making this decision now, everyone knows what that would be. It would be the same as yours. However, that isn't, just allow me to finish there. That isn't what this panel can do, and I'm as frustrated as anyone with that, but I think you've set out your position very, very clearly. It is a frustration for the panel, but clearly we don't get to make the decision, we get to scrutinise the decision that someone else has made. And I think, if I may say so, Chairman, you've set that out really, really clearly, and it's unfair for you to be criticised in public for something that you can't, change.
I don't want any...
Councillors have the power to refer the issue to the UK's Secretary of State for Health, but that's not happening.
You know, we will have to put pressure on the City Council and our MP that a campaign to the Secretary of State to reverse this decision is taken. We believe that the Council has the powers to do that, and it should do that. Councillor Royston Smith is a Conservative MP, and he should access his Secretary of State for Health and make the case that these resources are needed, and we ensure that these services are protected and people in the community get the care they need.
Instead of reversing the decision, Southampton councillors will now monitor how the closure is carried out. They're calling for more public awareness of alternative health services and better access to these services, like GP appointments. The clinical commissioning group has come under fire for not researching patient transport problems in enough detail.
We wanted to, it wasn't necessarily something we considered at the beginning of the consultation, it was as we were getting the feedback from people from public events and some of the focus groups, and also from the HOSP, that triggered us to look at that. So by the time we got to that point, we were towards the end of the consultation.
And we all knew, and we all know, that many people have said, even when we weren't in an official consultation last time, because we abandoned it before the general election, is that people's major concern was that if this service on the east of the city were to close, they would struggle to get to the alternatives. So we knew that really right from the start. So I can't say that I accept your explanation, Peter, that we only thought about that during the public consultation, and therefore we only had a very short time left to look at.
Have spoken in favour of the walk-in service. Some say the NHS 111 phone line isn't good enough.
You know, I've worked in the care sector, and it's disgusting when you've got somebody, I can't mention names or anything like that, but I had a gentleman in severe pain because his catheter was blocked. Now I had to wait 6 hours
for a GP to get back to me on a phone, and I had this guy crying at me. Can you tell me that's right?
The walk-in service costs almost £1.3 million each year. The money will fund community care and community nursing. Health officials say the cash would be better used for the growing number of people with long-term conditions like dementia and diabetes.
People have in the past not wanted to see people like pharmacists, but I remember 15, 20 years ago the suggestion that you might see a nurse to do a diagnosis or treatment plan was actually completely rubbished. Back then things have changed and ideas about what people are able to do has changed, and I think that's actually very healthy, because an awful lot of the kinds of conditions that have been seen by the walk-in service in the past have been things that frankly don't really need to see a qualified doctor. They're coughs, colds, sore throats, and they are the kind of things that we would hope to be encouraging people to access the qualified trained pharmacists who, as Peter says, do actually have 4 years of training, and they do have clinical training as well.
The fate of Bittern's walk-in has been sealed. Closure is expected within the next 6 weeks. Dale McEwan, Solent News Now.